and get to know your legislator. And I think nurses in leadership aren't really taught that unless they're getting a master's degree when they have to take a policy class. And then they're getting more actively involved with that legislation. But I think a nurse, even if they're an associate degree nurse, needs to understand advocacy and why it's important to form relationships with their legislators.
Clock in, scrub up, and join us behind the red line. You're listening to First Case, a perioperative podcast bringing you exciting interviews, engaging discussions, and innovative solutions that are changing the way patients receive surgical care. Each episode, we talk to frontline staff, perioperative leadership, and nursing entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the back table to the boardroom, from wheels in to wheels out, we tackle the real-life issues affecting the OR. Whether you're tuning in for surgical service education or inspiration, we're glad you're here. And now, it's time to roll back and start the first case.
On this week's episode of First Case, we're speaking with Kay Ball, adjunct nursing professor at Otterbein University in Westerville, Ohio. And she is a well-known advocate for smoke evacuation legislation and other legislation within the perioperative nursing community. And we're really going to just sit down and talk about advocacy with her today. What does that look like? How should we advocate? And what's the importance of telling our story when we're advocating? She's got a lot of really good tips and advice to share with all of us today. So stay tuned and we'll be right back with Kay Ball.
From the studios of Healthcare HQ, you're listening to First Case.
Joining us now is Kay Ball, adjunct nursing professor at Otterbein University in Westerville, Ohio. She has her PhD in health-related sciences and is the author of 4 books on laser surgery. And along with all of that, she is also a passionate OR nurse, passionate advocate for nursing, and former AORN president and former president of the AORN Foundation. So Kay, I'm a little starstruck, but thank you for joining us today.
Well, thank you, Melanie. I'm so excited to talk to you about my history of advocacy and what I've continued to do for surgical smoke evacuation in the ORs.
Oh, I'm so excited to have this conversation today because as I was listening to you at the OR Manager Conference in Nashville in October, you had an entire presentation about advocacy, about the work that you've done. You told these fascinating stories, and I'm like, this is our topic for the podcast for the spring. We have to talk to her. And you graciously agreed to come be on the podcast. So I'm very grateful. But I would like for you to just start by introducing yourself. Can you tell our audience just a little bit about who you are?
Well, I'm very proud to be a perioperative nurse. I did everything backwards. I had 2 children after I was married young, and I got my associate degree in nursing, then my bachelor's degree, then my master's degree, and then my PhD. And I always have been a perioperative nurse. I love the OR. I love taking care of the surgical patients and seeing the outcomes of all the good things that we do for surgical patients. I also am very involved with workplace safety, and that's where surgical smoke comes along, and we need to evacuate that. I've done my PhD research was all about surgical smoke. So two key things in my nursing career. One is that I was invited to work at the White House in 1994 to represent nurses in specialty practice when Hillary Clinton was attempting healthcare reform. And that was an eye-opener to see how slowly things move legislatively sometimes. And the other key thing that I got to be involved with, I got to plan and be involved with the surgical team, conduct the first laser surgery on a dolphin at SeaWorld. And we really expanded Lucky, the name of the dolphin, her life with this laser surgery that we did for the time ever.
Okay, you've got to tell the story. Tell us about Lucky. Tell us about what you did with this dolphin.
Well, we had a laser course at Mount Carmel, and it was for physicians, and 1 day lectures, second day hands-on. So I invited our Columbus Zoo main vet, and he said, if I can come, that's no problem, but what about my friend who's a vet at SeaWorld in Aurora, Ohio? That's when we had a SeaWorld there. So I said, absolutely. So Dr. Sam Dover came down from SeaWorld and listened to the lectures. And on the second day came to me and said, I have a dolphin with like a squamous cell cancer on the outside of her mouth and her upper palate. And she's not eating anymore. And we can't use electric surgery on her, of course. And we can't just cut into that highly vascular skin that dolphins have. So lasers may be it. So I said, well, you figure out which wavelength you want and I'll get that all arranged. So they wanted a contact YAG laser. We got the surgical team. We went up and took Lucky, the name of the dolphin, out of the water to do test spots on her and see how she would do. Well, she did fine. Within the next time we went up, we actually did the surgery on the back of a flatbed truck, and we were all there very intent on keeping her comfortable. We gave her narcotics and a fish before we took her out of the water, so she was a little bit high when we got her on the truck flatbed. And so we did this surgery, and the third time we had her out of the water was for some touch-up spots. And so Lucky did very well as her nurse. I would go up and see her at SeaWorld, and the trainer would have her turn upside down and open her mouth so I could see her upper palate and touched around on the outside of her mouth. And she was a very compliant patient. So it showed that, yeah, we can actually use lasers on dolphins too, as they do with many other animals today. So that was an exciting adventure to be involved with.
That is just so cool to me to expand the practices that we have on patients and see our patients not just being people, but even animals benefiting from what we're learning with the advancement of surgery and how we can improve their quality of life too.
And one other little aside, this was back in the early 90s. And of course, I was there involved with the surgery. I was manning the smoke evacuation tube and helping with dabbing the surgical site. And so I was like one of the first assistants in that surgery, but I had my smoke evacuation tube there too.
I'm very proud of you. I would stand up and applaud, but then the clapping might affect the sound. But that's so important. And we need that smoke evacuation, and we need that not just with laser surgeries, with any of our smoke generating procedures. And I know we're going to get into that later in our conversation. But before we move further into the advocacy, you also mentioned your involvement with the Clinton administration and being in a role in government. And I want to hear what you did. How did you even get asked to be part of that role?
Well, after I was president of AORN 92-93, I ran for the vice chair of NOLF, the ANA's Nursing Organization Liaison Forum. And that organization represented different specialty organizations like AORN, like the recovery room nurses, like the ER nurses, the ICU nurses. So it's all the different specialty nurses. And so when Hillary was attempting healthcare reform, they wanted a nurse with that outreach to specialty nurses. And so I had an outreach to over 75 nursing organizations of specialty nurses. And because of that, I vice chaired NOLF with the president of ANA. And because of that linkage, the White House asked me if I would like to come and represent them in 1994, in the summer of 94. So I moved to Washington. I knew it was going to be temporary. So my family was at home in Ohio. And I just helped with different activities like Health Express, Health Security Express, and different things about what we want as nursing specialists in the new healthcare reform arena. And so I got to do press conferences with Donna Shalala, Secretary of Health, and Senator Jay Rockefeller. And so it was an eye-opener as to how slowly things move and how the media can take things and twist them around and not be the factual information. But anyway, it really taught me the art of advocacy. And I took media training. ANA made sure, American Nurses Association made sure that I had media training and was able to address audiences, big audiences. And I actually came home and my past hospital president said, I saw you on TV, and C-SPAN, and you were up there representing nurses. And I said, oh, I'm so glad you got to see that. So it was an honor to be able to do that.
That is just incredible. I didn't think about it until I listened to your presentation at the OR Manager Conference, but there is an art to advocacy, and there are these things that we don't necessarily know how we're presenting ourselves and how we are communicating and telling our stories and really getting the people we're talking to latch on and understand what we're saying. And you were able to really teach a lot of that in your presentation. And you've even hinted on it already. But in your opinion and in your experience, what is advocacy? What does that look like in the nursing world?
Well, advocacy is a public support or a recommendation of a particular cause or a policy. You're acting on behalf of others. Maybe I'm advocating for my patients, or maybe I'm advocating for workplace safety. But it's promoting my point of view or my position, and the foundation of advocacy is being passionate about what you're supporting. And that has to come through with your verbal communication, with your written communication. And if it doesn't come through as you tell your story, then you're not going to be as effective as an advocate.
Right. And it's so important that we do tell that story, that we don't just list a whole bunch of facts, but not really relate it to anything. Right. I mean, like I guess it can't be understated how important it is, but
well, let me interject.
Go for it.
Nightingale in the 1860s was our first big nursing advocate. She said that the world is run by those who show up.
Exactly.
And if we're not there passionately supporting an issue, whether it's patient safety or workplace safety, it won't happen. So we have to allow our story to carry our passion forth in what we're trying to communicate to people.
Absolutely. Take it all the way back to Florence Nightingale to really just have that voice for nursing and to be able to represent for our patients. How does telling a story, though, how can we make sure that our stories are understood by the legislators or by the senators or congressmen that we are talking to when we are trying to advocate for a change in patient care?
Well, they have to know, the legislators have to know that you are truly indebted into what you're talking about, and you're knowledgeable about what you're talking about. And I always tell the nurses there are three groups of nurses: those who make things happen, those who watch things happen, and those who just don't know what happened. So, you have to figure out which group you're in,
right,
first of all. And then from that, you just have to not procrastinate. Procrastination is the art of keeping up with yesterday. So we don't want to keep up with yesterday. We want to keep up with tomorrow. And legislators like to hear your stories because they can feel your pain. They can understand more logically about what's really happening. And if you use workplace safety like surgical smoke, they can understand, well, I didn't even know that smoke was being formed when you're doing surgery on people. How's that happening? And so you go on, using energy tools, making surgical smoke or plume, and we're breathing it in. And my actual research shows that nurses who work in surgery are reporting twice the incidence of respiratory problems. So as compared to the general population. So we're breathing something funky in. So we've got to get rid of surgical smoke. So we need to advocate for workplace safety, or advocate for appropriate patient positioning, or advocate for making sure that we have long dry times after we do an alcohol prep on a patient. So we just make sure they're in a safe environment. But legislators like the stories.
Oh, they do. No, the stories help people relate. And we can all understand that at some level, because anytime you hear a story and it actually puts that into context, then suddenly it's not just theoretical, it's tangible. And I can really understand that. How do we go about changing practices, whether it's at the state level or whether it's at our facility? How do we get started?
Well, the nurses have to understand, if they're going to advocate for an issue that will require a law, they have to understand the legislative process. They have to build relationships with that legislator. They have to understand the importance of legislative aid, because they're the gatekeepers for the legislators. They're going to let you in, or they're not going to let you in. And they have to be able to participate in legislative activities by knowing these folks and going to Nurses Day at the State House, or going to candidates nights or candidates forums, and get to know your legislator. And I think nurses in leadership aren't really taught that unless they're getting a master's degree, when they have to take a policy class, and then they're getting more actively involved with that legislation. But I think a nurse, even if they're an associate degree nurse, needs to understand advocacy and why it's important to form relationships with their legislators. So first of all, do you know who your state senator is? Do you know who your state house member is, if that's the type of government within your state? Do you know who your congressman is? That's at the federal level. Congressman is at the federal level. Do you know your 2 state senators in the federal government? So just knowing who those people are, and maybe they're on a health committee, and wow, that's good because now they're more interested in what you have to say because it involves healthcare related issues.
So it can seem a little intimidating. I know, and this is a personal thing for me because I have recently reached out to one of the senators within my own state, and I was incredibly intimidated thinking about sending them an email when reality is they represent us and they want to hear the issues that are affecting people within their state. But to think, oh my gosh, little old me is sending an email to this really important person, and are they going to read it, and am I going to word it correctly? But when we do reach out to our representatives or to our senators or congressmen, is there anything maybe we should really be saying in our emails, like that first communication to get to know them, or anything we should tell them about us?
Well, first of all, you can get to know your legislator by looking online. You can know what committees they're in. Maybe they're on a health committee because they have a child who's autistic, so you know where they're coming from. But you need to know the legislator. And then you want to tell them about you. Yes, I am one of your constituents. I live in your district. I vote for you or I don't vote for you. That's important to them. And then they want to know, what your line of work is, because they can't know everything. It used to be my House member in Ohio. He is more of an agricultural type of guy. And so he learns from me as a nurse. I can tell him about surgery things. I can tell him about nursing issues. And so they're very open to know your story, to know your research. Like they're very interested when I simplify it and make it understandable to a non-healthcare person. This is what we're breathing in surgery, and please take action on this. And so one way that we've done this in our local AORN chapter is we've had during COVID, we had a virtual conference and invited a Republican, a state senator, and a Democrat state senator. And we talked to them about how we can form strong relationships with you so you can understand more of the issues that we have, and we can understand more of how we can help you achieve your goals too. And so they were very interested in helping us understand this relationship building process and what they need, what their expectations were. And on the other hand, then at the end, we told them what our issues were. And the number one was surgical smoke. And they didn't know anything about surgical smoke. And so that's when they put together a bill and introduced it, bipartisan bill. But that bill just kind of sat in the health committee even after we had testified for it. And it died when the General Assembly ended that year. But then it was again reintroduced right away, and it is through now. We're done with that, but we can talk about more of that later.
I know. I am so excited actually to celebrate that with the state of Ohio, because that is wonderful news for everyone within your state to be able to have that legislation to provide that safety. But I want to actually go back to that experience with your interaction and your relationship with your representatives. You met them, you got to know them. They heard your story. They heard about the issues specifically affecting perioperative nursing or anyone within the operating room space. It's not just nurses who are affected by surgical smoke by any means. And then you got a bill introduced, but then it died. So then what happened? How did you keep that interest alive or keep that bill moving to get it to show back up the next go round?
Well, I worked very closely with Senator Andy Brenner in Ohio Senate, and he was still very interested in that. And he said he would reintroduce it, which he did. But in the meantime, we've been working very closely with AORN, another key element, and very closely with our state nursing association, which is called ANA Ohio now. And they were all very supportive. So we kind of gathered more people. And that's so critically important when you have an issue, is to gather the population, because legislators are impressed with that. And so we just tried to simplify everything. And this is what we need. Here's an example of a bill that passed in another state. That's very important too. And so they had something to go on. And here's who opponents have been in other states when testimonies have been given. It's usually the state hospital association. So immediately Senator Brenner called the Ohio Hospital Association and said, we're going to have a bill again, and we'd love for you to support it. If you can't support it, just please remain neutral and not go against it, and which is exactly what happened.
Wow.
And so he met our opponents head on and helped them understand why this was important for Ohio perioperative nurses and surgical teams. And so it was successful.
That is incredible. And what number was Ohio? Was Ohio State number 13? Is that correct?
Number 13.
That's
number
incredible.
13, July 3rd, 2023, Governor DeWine signed the budget bill. So what happened was, immediately when this new General Assembly started, and our General Assemblies are for 2 years, started in January 1st of 2023, we had a bill in the House and a bill in the Senate. The Senate bill got to committee. We testified. One surgeon and 3 nurses, including myself, testified, proponent testimony. Nobody showed up for the opponent testimony. So we were happy about that. And in the House, we were ready to do testimonies in the House for the House bill. And our lobbyist that AORN so graciously hired for us, who knew everybody and everything going on in Ohio's legislation, he really worked with the Ohio legislators and said, let's put this bill in the budget bill, because the budget bill has to be passed and signed in early July. So it was put in the Ohio budget bill and got through the House. It went on to the Senate, our 33 senators, and it was taken out. Well, immediately, Senator Brenner and 3 other senators, one of whom's a physician, put it back in. And so then it went through the Senate for approval, and it went to conference committee for approval when inside the budget bill, technically inside there, and then it went on and it was passed, and then the governor signed it on July 3rd.
That's incredible.
We would have been there in force for the signature, but the governor said, no, we're not going to have any fanfare for this. We're just going to sign it.
Well, that's a little disappointing not to be able to be there when it got signed.
Right. So October 1st, it went into effect, and then they have until next October 1st, 2024, for everybody to be compliant in the state for all surgery centers and all hospital surgery departments. So our next battle, as we talk to other states like Rhode Island and Julie Greenhaw, who helped push that through, is what about surgery being performed in doctors' offices that aren't listed as surgery centers? And they're using bifurcators. They're still producing smoke. Shouldn't they be not breathing in the fumes, the particulates, and the odor from surgical smoke? So that would be a next thing that we try to accomplish. And, sometimes gastroenterology centers that do colonoscopies, they produce smoke when they use electrosurgery on a biopsy or whatever they're going to remove in the colon. And so we still have things like that we're still having kind of dirty air in some of those environments that we want to clean up.
Yeah. Well, it just shows that the work's not necessarily done just as soon as you get a signature. There's enforcement, there's education, and then seeing really the far-reaching effects of the issue, in this instance, surgical smoke. Like, where are we seeing it? It's not just in a hospital OR. It's not just in a surgery center. And providing that education so that everybody can be protected and everybody can be safe, because that is the goal of the advocacy, is to advocate for the health and well-being of the healthcare population who is exposed to the surgical smoke or whatever issue you might be advocating for. One other thing that you talked about in your presentation, and then I know you've talked about it before, but there's some do's and don'ts. When you are advocating or you're telling your story, there's things you should do and things you shouldn't do. Do you mind kind of educating us on those do's and don'ts?
Okay. And again, the art of advocacy is really not taught in academic environments. It's something that you kind of acquire. And you can take media training like I did when I worked at the White House, but you can be advocating anywhere, whether it's a discussion at a meeting or in front of an audience or debating or just talking to a legislator. You can be advocating. But the first thing you need to know as an effective advocate is to know your audience. Are you talking to fourth graders about being a perioperative nurse, or are you talking to legislators about hazards in our workplace? So you have to know your audience and gauge your presentation towards that audience. You need to identify yourself. I'm Kay Ball, and I'm an adjunct professor at Otterbein University, but I am representing myself. I'm not representing Otterbein University. So that has to be clarified right away. And maybe I've been told that I am representing Ohio Council for Operating Nurses, or I'm representing ANA Ohio. Then I could say that, but it has to have gone through the channels to be representing that organization. So when you're talking about an issue, you want to have 2 or 3 key points. People can't comprehend a whole list of 10 different points that I want to bring up. 2 or 3 main points that you want to bring up about that issue. And yeah, your passion, again, has to come through. You have to make them feel what you're feeling and have that emotion towards, you've got to pass this. It's really a disservice to our perioperative community, our surgical team members, if it's not passed and we have to breathe in clean air. You have to be concise. Figures, that 77% of the particles in surgical smoke are less than 1.1 microns in size and smaller. Dr. Mahashi's research from years ago. Data like that and facts and information like that is very, very important. But use quotable language, because sometimes non-healthcare providers don't understand what you mean by PRN or stat or words and jargon that we use in healthcare. So don't use that jargon. And if you speak to them in images, like life is like licking the honey off of a razor's edge, you can almost feel that. And so use those images, use your experiences, use lists of 3, red, white, and blue, life, liberty, the pursuit of happiness. Your mind can't comprehend much more than that. So don't use more than 3 in a list. And another thing is to use contrasts. I always use Kennedy's, ask not what nursing can do for you, ask what you can do for nursing when you're talking, and people will understand that. And if you want to emphasize something, do it at the end of the sentence. If you want cost, quality, service, use a perioperative nurse as your leader. You have that. If you'd say it the other way around, use perioperative nurse leader if you want cost-effective services. So put that emphasis of what you want at the end of the sentence. And one problem that nurses always have is, well, they've asked me a question and I don't know the answer. And they're embarrassed to say, I don't know. It's okay to say, I don't know the answer, and I'm going to get back with you by next week and what that answer is. And make sure you follow through and get back to them then. But if you don't know, just say you don't know. But you'll look into it for them. And just try not to get caught up in a compromising situation or an opponent who's really going to challenge you. Try to always keep things professionally. And so when you're person to person with them, you want to dress professionally, look professional, and don't forget to, you're able to gesture if you need to gesture. Your body language speaks a lot. Lean forward and look at them in the eyes and let them know that you're really passionate about something. Those are all just some little key elements of being passionate about a topic.
That is so helpful, though, to think about the granular details, that it is okay when you're speaking to a legislator to potentially not know the answer to their question, but you will follow up and you will give them the answer. And that I think can take some of that burden off of having to have all of the facts and figures right there on the tip of your tongue and be prepared for every possible question, because that's incredibly overwhelming if you're not the researcher who researched all of it at the beginning, but you are still passionate about getting this, getting something changed within your state.
And that can help you so much. We were doing our proponent testimony on surgical smoke evacuation, and we had a question about workers' compensation. And I didn't know the answer. And I just said, I really don't know the answer, but I'll find out for you. So later, afterwards, Senator Romanchuk found me and Donna Doyle and said, hey, I'm in charge of the state workers' comp committee. And I want you to know that there's money for safety devices to be purchased in healthcare environments. So if an ambulatory surgery can't afford a smoke evacuator, they can come to us and workers' comp can help them buy it. And
that's
so
incredible.
That was something that I didn't know. And it all worked out well because I said, I really don't know.
Yeah. And you learn a lot sometimes when you admit that you don't know. You can find out all sorts of other information.
Exactly.
We are unfortunately coming to the end of a very fascinating conversation. These go by so much faster than I ever want them to. But before we go, I want to give you the opportunity, if you have any advice or any final thoughts that you want to share with anyone who's listening who thinks that they want to dip their toe into advocating for something, or they're passionate about something and they really want to see it changed. What's your advice to them?
Well, I would say that just be committed. I mean, be passionate about what you really want to happen. And I can end with this very, very important little story about a pig and chicken walking down a country road and saw a sign in a restaurant window that read ham and eggs, $1.49. Chicken looked at the pig and said, wow, what would that be without my contribution? And the pig just reeled back and said, what? Your contribution? For me, it takes a total commitment. And so, I always ask nurses, are you just contributing or are you totally committed to this? Because if you're totally committed, then get in there and be passionate about it and make these changes, because every single nurse can make changes in our healthcare environment today.
Wow, that is incredible. Thank you so much for joining us, Kay. I am so appreciative that you shared your expertise and wisdom with us today.
Well, thank you so much. I'm blessed that you asked me to do this, and I hope that a lot of people will get more passionate about legislative activities and how they can change the healthcare environment.
That was Kay Ball, OR nurse and advocate for all things perioperative nursing. A lot of things to take away from in this conversation, but really all of us are advocates. We can all change practice. We can make things better for our profession and for our patients. We just need to use our voices and speak up and bring about change. And on behalf of all of us here at First Case, thank you for listening to this week's episode.
Thank you for listening to this week's episode of First Case. As a reminder, you can help support us by subscribing to First Case on your favorite podcast app or by downloading the smartphone app on iPhone or Android. Simply search for First Case in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@firstcasemedia.com. We look forward to hearing from you.